I was a marathon runner when I realized that I had some hip issues, and we had realized that I had hip dysplasia. So I ended up having to have a surgery for the hip, which actually created complications in my back. And then after the surgery, I was not doing anything at all. I was protecting the hip, and I was told not to run, or maybe I would never run again. So I was a little bit disappointed that that was the prognosis, but I never gave up. I saw 4 physical therapists. It finally made my way and was recommended to Jessica. That's when I started to realize that running might be a possibility again, even though everybody kept telling me, you're never going to run again. But through Jessica, she inspired me to get into the pool and swim more and cycle more. So throughout my physical therapy with her, I was conditioning aerobically by swimming and cycling. And she had finally worked me up to running 4 miles at one time by the end of my physical therapy sessions with her. And so because I had been swimming and cycling, kind of added everything together. So by the end of my about 8 months with her, I was able to swim, cycle, and now run a little bit, and now I've progressed into doing longer distance triathlons. Because people recognized how much progress I had made in such a relatively short amount of time. And the answer was always Allegheny Chesapeake physical therapy, and specifically Jessica, who was working with me. They are willing to do anything and everything, go above and beyond just the practice of physical therapy to make sure that they're not just meeting the needs of the problem, but the patient. So it was really helpful for me to be able to talk to somebody about my goals and not have somebody shoot down my goals the very first time they met me, because that was one of the issues that I had. People would tell me, you're never going to run again, you're never going to be able to do this, you should consider stopping this or not doing that. And when I talked to Jessica for the first time, she said, okay, now that we realize what your goal is, let's start working towards getting to that goal. And I was so appreciative for the first time somebody on the first session didn't say, you're never going to run again. It was the positive attitude that they had and the willingness to listen to what I wanted or needed as a patient, and then being able to adapt with my needs. So it wasn't just textbook material that they were trying to do with me. Sometimes it was out of the box thinking that made me feel better. So her willingness to adapt and change with me was really important for me.